Hi, I'm Allie.
And I'm Becky.
We are registered dietitians that are passionate about food as medicine.
In this video, we are going to be talking about common side effects of Ozempic and how you can offset them using food as medicine and supplement solutions.
So it may not come as a surprise to y'all that we are not big fans of these injectable weight loss drugs. Whether it's Ozempic, Wegovy, or any form of a semaglutide GLP-1 agonist. In fact, in this video released 2 weeks ago, we talked about why we love the ketogenic diet instead of Ozempic. So if you want to hear the skinny on it, be sure to check out last week's video.
So whether you've made the choice to be on Ozempic or maybe you've been on it in the past and have weaned that medication but are still experiencing side effects, we're here to empower you at any stage in the game.
All right, let's kick off with the first symptom that I think is the most common, which is digestive side effects, nausea.
Yes, so we're looking at 44% of Ozempic users reporting nausea as a side effect. And I had a client recently tell me that it feels like having morning sickness all day long. This is likely due to the mechanism of those GLP-1 agonists working on delayed gastric emptying as one of their mechanisms, right? Food is sitting in the belly for a longer period of time, kind of over fermenting, churning, causing you to feel overly full and not hungry, but also can cause that nausea or reflux or other adverse symptoms.
So on a food as medicine level, you might check out this video where we talk to you about how to do an ACV shooter. Taking a 1-to-1 ratio of apple cider vinegar with water is a great way to stimulate and rev up your digestive juices, support bile flow, and pancreatic secretion. And then on the supplement side of things, we would recommend our Digestaid enzyme. So this is going to have an entire suite of digestive enzymes to help your foods on a chemical level to break down. So offsetting a little bit of that mechanical stagnation so that that food doesn't sit there and ferment. And also this works on the pancreatic level because we can see a lot of pancreatic inflammation from use of these medications. When taking those digestive enzymes, this can offset and reduce the stress of the pancreas to have to produce more in the first place.
So taking 1 to 2 Digestaid prior to every meal would be a great way to offset that nausea and sluggishness and also aid in bowel motility.
The second area of concern is sarcopenia or muscle wasting. In fact, we see this as a huge symptom of use of these medications, and people are losing weight on the scale, but they're not retaining their lean body mass. That in turn will lower their basal metabolic rate, keeping them kind of forever patients, if you will, or having to stay on these medications to retain the weight loss results. Because as your basal metabolic rate goes down, this means that it's easier to regain weight. And if you're losing muscle, that means that your weight loss is not as much from the fat stores that we actually would like to see loss. Sarcopenia or muscle wasting is actually a risk factor that everyone faces starting at age 30, and we have a risk factor of losing 3 to 5% of our muscle mass every decade. So we're already working against the clock if we're an individual that's perimenopausal or in our mid-40s or 50s and on this medication. This is where the power of protein is super important. We want you to actually eat 1 gram of protein per pound of body weight as your food as medicine solution. This is going to feed that lean body mass and offset the disease factors of sarcopenia, which can literally drive all-cause mortality or reduce your quality of life and increase your risk of death. Now, beyond eating enough protein as a supplement solution, we're going to recommend our naturally nourished grass-fed whey. What's super cool is we've actually seen in research that grass-fed whey can increase GLP-1 release in the body. So you can actually get more satiety if not on this medication, or if you're weaning off of this medication, it would be an extra argument to ensure you're getting an added scoop of our grass-fed whey, because that's gonna offset some of the shifts that you might see in a rebound of strong appetite or hunger.
So another common side effect that we're seeing is gallstone formation and systemic inflammation. Inflammation along the GI tract, but just inflammation increasing in general in individuals taking these drugs. And so one thing that you can do is to add turmeric into your diet. Turmeric is actually going to aid in bile flow, helping to reduce gallstone accumulation and formation, and it's also going to help to reduce that systemic inflammation. What's more is curcumin in turmeric has actually been shown to increase GLP-1 naturally instead of having to rely on one of these drugs in the first place. So we could be adding our turmeric into bone broth. We might make more curries, or you could make these turmeric roasted cashews, which are a delicious, savory, salty snack, or salad topper.
When we're looking at a supplement solution, we would recommend our super turmeric. This is basically nature's Advil. So toss your NSAIDs of Motrin, Aleve, ibuprofen, and Advil because those can wreak havoc in the gut. Using super turmeric is a great way to offset inflammation as a natural anti-inflammatory. In fact, this video here goes deep dive on the mechanisms of our super turmeric supplement. And we've seen benefits of use of turmeric supplementation to support gallbladder health.
The fourth area of concern is gastroenteritis, or intestinal infection. And this is due again to that delayed gastric emptying, where we can see unfavorable bacteria growing and proliferating and kind of fermenting that unused food source, essentially. So what we can be doing to combat this is making sure we're bringing in favorable gut flora and getting our microbiome to work with us instead of against us. So bringing in a quality probiotic like our Restore Baseline probiotic as a daily supplement would be a great foundational tool. And then we also could bring in a fermented food daily like kraut or yogurt or kombucha to help offset that side effect.
And finally, the fifth area of concern is loss of turgidity or elasticity in the skin. In fact, this has been deemed Ozempic face, where people are looking really gaunt. Some of this has to do with their low protein intake and the loss of muscle, which plays a huge role with connective tissue. And so we would look to strategically offset this with our pure collagen. Our pure collagen, especially if paired with a smoothie that has vitamin C rich foods like berries or citrus, would be a great way to actually enhance collagen synthesis. This is going to support that tightening of the skin and the elasticity while reducing that sag that we can see from the medication. And what's wild is, as I was looking into the side effects for today's video, I saw, no worry, we have surgical procedures to offset your Ozempic face. You can get fillers, you can get a facelift, you can get a brow lift. And this just really seems like a turn spin of consistent feeding the pharmaceutical industry big outputs from the individual versus supporting their body from the root cause and actually enhancing their quality of life with whole body health. And I think that's the benefit of leaning into these food as medicine solutions and supplement solutions. Not only can you offset the impact of this drug, but you can actually correct a deficiency or enhance whole body health.
Yes, and I think if you're looking for a solution that is not a medication and much more sustainable in terms of the weight loss outcomes, but also just whole body health, keto is really a great place to turn. Check out the details below for our 3-month Food as Medicine ketosis program, where we walk you through the process of becoming fat adapted, using your own body fat for fuel, and we support you in your food choices, your macro goals, really just educating yourself on how to make this a sustainable lifestyle shift. Plus, we add a lot of functional medicine information to really get your body working as best as it possibly can.
So if you like this video or you learned something, be sure to like and subscribe to the Naturally Nourished YouTube channel. Put a comment below in something you've learned and maybe something that you're going to change to offset the side effect. And if you've experienced the power of food as medicine.
Going outside the box here, Allie.